letting everyone in. All right, cool.
Oh yeah, you can see the numbers. That's kind of cool.
Yes. Okay. Hi, everybody. I want to just thank you for joining us today. I want to be mindful of everyone's time because I know everyone's busy. So I will get started. And just thank you for joining us today. We really appreciate your time and taking the time out just to listen to our wonderful panel today. We appreciate it. My name is Paul Sherman. For those of you who don't know me, I'm the Senior Programs Manager for SID Washington. So I help manage all the events that we do. So first and foremost, I want to thank all of our panelists today for joining us and taking their time out of their schedules. And also recognize our co-chairs too for this event. So Joni and Kara for the Education Workgroup, and Lara for the Health and Nutrition Workgroup for helping us to put this event together. I know it's been in the works for a few months, even before the start of everything that's happened with working from home and COVID-19. So I really appreciate all of you still sticking with us and sticking through to put this event on. We have a whole bunch of events coming up, so I want to touch on those really quickly before I hand it over to Joni. But we have 2 events this week coming up. After today, we have one tomorrow on the role of the media in the COVID-19 crisis, and we are a pandemic, and we are working with the SID Israel chapter for that one. So that should be really interesting. We have a lot of very interesting panelists, journalists from around the world. So I think there will be a fascinating event. The registration for that's still open until 4 o'clock today. If you're interested in joining that. We also have an event on Thursday on food insecurity at home and abroad. So that's going to be international focus, obviously, because who we are, but we also have a good chunk of the panel are just those who are working behind the scenes in the food, like with food banks around DC or and abroad too. So it'll be a fascinating event. If you have not signed up, if you like to sign up for that one, that registration is still open for that as well. We also will have a few other events coming up. We have a whole bunch in the works for June. So check out our website. That's where all the updated information is. And I will leave it at that. And with that, I will hand it off to Joni, who will get us started today.
Thank you so much, Paul. Thank you all who are in the audience, and to the panelists. We're super excited to be presenting this panel that, as Paul mentioned, has been in the works for a few months. Today, we're going to talk about the Nurturing Care Framework. And as a way of getting started, we're going to assume all of you know something about it, but I'm going to give a bit of a background, a little bit of an overview, and clue you into what our speakers will be discussing in their individual presentations. So from the Nurturing Care Framework, its definition is that it's a framework for helping children survive and thrive in order to transform health and human potential. And the reason we wanted to have this be a nexus of health and education is that all of us in the room know that we cannot do this work in isolation, that we really need to be thinking now in particular about the notion of multi-sectoral approaches. So nurturing care refers to a stable environment created by parents and caregivers that ensures children's good health and nutrition, keeps them safe, and gives young children opportunities for early learning through interactions that are emotionally supportive and responsive and proactive. And there again is where we talk about the nexus of health and education and the multi-sectoral efforts that are essential. Many of us who are educators know that this is what mothers, fathers, and caregivers, grandparents have been doing all of their lives. They don't work in silos the way we tend to, and we think about the spectrum of healthy child development with the lifelong and intergenerational benefits, health, education, social cohesion, the role of community, the role of organizations to support the family or unit, whatever you want to call it, however you want to define it. And as I mentioned, multi-sectoral interventions are critical. We know, and the evidence supports, that health, nutrition, education, social welfare and well-being, child protection, all have a critical role to play. The health sector in particular, with its direct reach to families and children's, from pregnancy to newborn, infancy, toddler, early childhood education, seems to really have the foundation from which the nurturing care framework could really build the momentum as it influences other sectors. So, as I mentioned, the framework builds on state-of-the-art evidence of how child development unfolds and the effective policies and interventions that are necessary to improve early childhood development. And again, I want to make mention, I did not say early childhood education intentionally. We are talking about a much more holistic view of children and their lives and the people that surround them. The framework was developed by WHO, UNICEF, and the World Bank Group in collaboration with the Partnership for Maternal, Newborn, and Child Health, the Early Childhood Development Action Network, and many other partners to provide a roadmap for ensuring attainment of the Sustainable Development Goals. It was launched alongside the 71st World Health Assembly in May 2018. And Matthew's presentation in particular will talk a bit more about all the organizations and actors and stakeholders that have come together to really launch this very important and exciting initiative. The framework provides an evidence-based roadmap for action and outlines how policy and services can support parents, caregivers, families, and other caregivers in the community to provide nurturing care for young children. In particular, it calls for attention to be paid to communities where children are most at risk of being left behind, of being not counted, and the nurturing care framework identifies a very specific set of best practices based on programs that have proven effective in providing early childhood development in high, middle, and low-income countries. Today, you'll see snapshots of some of those efforts and the way in which they have galvanized the community, stakeholders, and organizations to really make a difference in the lives of young children and caregivers and families and people who support them. What we've found is that effective national programs are driven by strong and sustained political commitment and determination to reduce inequality, poverty, and social injustice. They look at evidence-informed policies, services, and public communication to improve awareness of and knowledge about early childhood development. Investments are critical and are directed towards creating enabling environments and providing services and support for families and caregivers. Specifically, we're looking at the whole spectrum of enabling environments. And Katie's presentation will highlight how the nurturing care framework looks in the humanitarian settings, which does have specific differences from what we might call traditional development settings. The framework depends on a whole of society approach. And I love that. I took that from, I don't even know where I was reading, but I love that, particularly because it really talks about the fact that everyone has to be a stakeholder. Everyone, civil society, local and national governments, parents, caregivers, siblings, aunties, uncles, grandparents, academics, everyone has to play a role in how we think about early childhood development. Effective coordination, accountability is critical. And if you look at the website of the Nurturing Care Framework, there are some overarching principles and guidance about what things are essential to put in place. The framework calls on all governments and all stakeholders to take ownership of early childhood development in order to strengthen our investment in the sustainable future of children in our shared world. Erin will discuss ECD and nutrition from a donor lens as she gives us a snapshot into USAID perspective and how they think about the nurturing care framework. And finally, again, I took parts of this from things that I had read. The Nurturing Care Framework really believes that for us to help children survive and thrive and make sure no child, whatever the setting, is left behind, it's critical that we transform the health, human, and education potential of all children everywhere. Before I turn it over to our speakers, I just wanted to highlight the nurturing care components, and it's just a very brief overview. You really do need to investigate them for yourself, but I want you to be thinking of these things as we move along in our discussion today. The first component is good health, and that refers to the health and well-being of children and all of their caregivers, because physical and mental health of caregivers is critical in order for children to thrive, survive, and prosper. Adequate nutrition, safety and security, opportunities for early learning. And Katie in particular has a snapshot of brain development and the effects of trauma and stress. And then finally, the fifth one is responsive caregiving. And the whole notion, as I mentioned before, of that whole stakeholder body playing a role in being responsive to the needs of children. So without further ado, I'm going to pass it over to Lara, who's going to introduce our panelists, and we will get you started. Thank you very much.
Thanks, Judy. Hi, everyone. I'm Lara Ho, and I'm really excited to introduce our speakers. In order to give them a maximum time to speak, I'm going to be very brief. Their full bios are on the event website. The link is in the chat. So we'll be starting with Matthew Frey, who has over 25 years of global health, technical, and leadership experience in Asia, Africa, and the Caribbean. He's worked for Save the Children, and he's currently the Director of Early Childhood Development at PATH. Most recently, he's served on the global management group that designed and developed the Nurturing Care Framework and has spearheaded the creation of a regional partnership with WHO and UNICEF to support country contextualization and rollout of the framework. Next, after that, we'll have Katie Murphy, who's the Senior Technical Advisor for Early Childhood Development at International Rescue Committee. She has over 15 years of experience working in the field of early childhood development, educational, and sustainable development. Prior to joining IRC, she was the director of the Global Masters in Development Practice Secretariat at the Earth Institute of Columbia University. And with IRC, she served as the technical lead for the design of the Akman Sim Sim program, which received the inaugural 100 and Change Award from the MacArthur Foundation. And finally, we'll have Erin Milner, who is the Senior Nutrition Monitoring, Evaluation, and Learning Advisor at USAID, where she leads integrated nutrition and early childhood development initiatives and manages multi-sectoral nutrition programs. Prior to joining USAID, Erin led research in Kenya on nutrition linkages with ecosystems, food security, WASH, and early childhood development. She has held various nutrition-sensitive agriculture-oriented consultancies and directed several environmental health monitoring and evaluation programs throughout sub-Saharan Africa. So that's it, and I'm actually going to go ahead and turn it over to Matthew.
Laura, thank you. Joni, thank you. Let me make sure, first of all, that you can hear me. Audio's working?
Yep.
Great. And I want to thank all our participants for making time today to learn a little bit more about the Nurturing Care Framework. I'm going to provide a window into the progress being made with the Nurturing Care Framework introduction. And I'll try to provide an overview of what we, the global community who developed this framework, hope to see happening, the focus on health systems across the globe as part of a new routine standard of care. And I'll also provide a few thoughts about opportunities to further accelerate and enhance this effort over the coming years. And of course, can't ignore COVID-19. I'll share some perspectives on how that's impacting work in the countries where we're working in Africa. I'll focus my remarks on Eastern and Southern Africa, where PATH has been doing its pioneering nurturing care work since 2013. Next slide, please. So until recently, we really did not have a very good idea of the extent of the problem. We didn't know a great deal about child development status. We didn't have good country level data. And in 2016, the Lancet special series on ECD really served to bring into focus the enormous scale of the consequences of not addressing child development. They estimated that fully 66% of young African children are at risk of poor development. That's over 90 million children. And they also really synthesized both the brain science and the implementation science to emphasize the importance of the issue and the solutions that we have in hand to address the issue through early interventions. I want to just draw your attention here quickly to the countdown to 2030 data. And you see the Mozambique example on the slide here. This data is terrific. It's compiled by Linda Richter and her colleagues at the University of Wits in South Africa, and it offers a wealth of the most current ECD data analyzed country by country. You can find it on the ECD Action Network website. Next slide, please. So with an increasing understanding of brain science and a growing body of evidence about the impact that we can have through early interventions, PATH as a global health organization took note that child development was really, we weren't seeing it very present in health systems in countries where we were working. And around 6 years ago, we were asked by the Bernard van Leer Foundation, a foundation out of The Hague in the Netherlands, that had been working since World War II on ECD in a very focused way, to do some more detailed landscaping. And we were asked to look at 9 countries of Western, Eastern, and Southern Africa and do a deep dive looking at health policies, health technical packages, indicators, curriculums, job aids. And what we concluded from that effort was that, with the notable exception of South Africa, that we were really seeing an absence of child development focus in any of these countries' health systems. There really weren't large-scale program efforts in place. And there was really a noted lack of leadership and interest within ministries of health, who really felt that ECD was not their business. Next slide, please. So in this challenging context, PATH set about working with ministries of health in Kenya, Mozambique, and Zambia initially to design and pilot and evaluate early interventions within the health sector context. And I share with you here sort of a synthesis of the 5 key services that we launched and concluded were really central to weaving child development into health sector services. And they include, first, that children are routinely monitored over the course of the early years for achievement of their developmental milestones. That providers check for risk factors for child development. And these include notably maternal depression or domestic violence that can have an enormous impact on developmental outcomes. That caregivers receive counseling on age-appropriate responsive interactions and early learning, stimulation, communication activities with the child. That these basic domains of the nurturing care framework are reinforced during the delivery of services through counseling interventions. And the kids who are lagging behind or have important developmental delays or disabilities are identified and referred to more specialized services. In general, we concluded the need was to reinforce missing or weak nurturing care content along that whole continuum of care in maternal and infant nutrition, MCH services, and HIV program platforms. Next slide, please. And we also stressed that we needed to look at all of the various touch points that the health sector uniquely reaches. And we, during our sort of early formative research, we saw that the health sector was reaching families between 15 and 30 times typically in different countries of sub-Saharan Africa. Much more contact than any other large public service platform, underscoring sort of the critical importance of utilizing the health sector to improve child development outcomes. So in addition to, of course, home visits, we need to look at health facilities themselves and include waiting rooms where patients often wait for 1 to 3 hours to receive care, as well as the consultation room. And other community platforms, we also stress the use of mass media as a way to reinforce new parenting practices and change social norms. Next slide, please. So I think the nurturing care framework really validated and underscores that we need a systems-based approach. We need to look at the health system architecture in all of its components and weave ECD, particularly responsive caregiving and early learning, into all of those elements of the system, including policies, standards, and guidelines. Workforce training, that's pre-service training and in-service curriculums, planning and budgeting, the ways that the health system measures its performance and monitors the delivery of services, and of course the delivery of services themselves. Next slide, please. So as we were doing this piloting, the world was really coming together around child development during the early years. And Joni mentioned a few of those critical activities, but I think the first one was really the 2016 launch of the Lancet special series on ECD, which really summarized in a compelling way all that we know now about ECD. And it was a structured activity that also included country level advocacy, where a roadshow that really brought to the attention of senior government all of this body of evidence, and built a receptive environment for the work to come. And then there was a series of global meetings which countries from around the world were invited to participate in, and I think really strongly influenced. It culminated, as Joni mentioned, in the 2018 May World Health Assembly, where all ministers of health universally endorsed the nurturing care framework as a way forward. I think the process itself is notable in that it really brought together and coalesced a spirit of collaboration and a sense of urgency around this issue. And it gave certainly credibility and validity to the framework itself as a guiding document that enhanced government interest and really accelerated the uptake of the framework. Having been working in this field for 7 years, we really saw a massive shift in momentum from all of the global attention and the coming together of partners around the issue, who then began working in a coordinated fashion to support government in introducing the framework. So I'll just give a few examples, and there are many. On the left here, you see a new newborn child and adolescent health policy introduced by the Kenyan government. And for the first time ever, this was in 2018, child development is one of 6 key pillars of that policy. And they've followed it up with a new newborn child and adolescent health strategy this year. On the right, you see a new child health booklet launched by the Ministry of Health in Zambia in 2019, which now contains 3 full pages dedicated to responsive caregiving, early learning, and developmental monitoring. That's out of 22 content pages. So it's really an expression of the importance of this issue to the government of Zambia. Next slide, please. Jumping over to Mozambique, we see examples here of new standards and guidelines, technical guidelines for nutrition rehabilitation and the child at risk consultation norms and guidelines that have been introduced in the last year. And partners have been working to support the ministry in integrating child development into these documents. Play-based feeding, cognitive stimulation are now important cornerstones of this technical guidance. Next slide, please. And here we see developmental monitoring tools that have been woven into well baby consultation norms and indicators in Mozambique. This is an adaptation of a great package called the Care for Child Development Package, which WHO and UNICEF launched in 2012. And this is an adaptation which is now being used in 4 countries of Eastern and Southern Africa as part of IMCI packages, revised IMCI packages, well baby and sick baby consultation norms and guidelines. I also want to stress indicators. We have seen in the last 18 months, for the first time ever, health systems introducing and approving new child development indicators. Number of children with developmental delays is now being tracked for the first time by governments of sub-Saharan Africa. Thanks. Next slide, please. And just some quick visuals so that you can see the nurturing care framework in action. Here you see nurturing care has now been introduced as part of a rotation of topics at morning talks at an MCH clinic. A nurse is using the child development monitoring poster, which can be found now in over 1,200 health facilities in all 11 provinces of Mozambique. Next slide, please. Here you see a waiting room and a health worker doing play demonstrations and toy making demonstrations to patients as they wait to receive care. And these are all handmade toys, homemade toys made from waste products and trash, really. Incredible creativity we're seeing from our different countries in Africa to make toys that kids love to play with. And here you see kids, next slide, please. Here you see kids involved in free play. And I mean, in general, the push from governments has been to make health facilities more child friendly. And in so doing, we're seeing utilization going up as these health centers become places that children and families like to come. Next slide, please. Shifting to the consultation room, here you see pictures of nurses doing counseling and monitoring of milestones. On the right, you have a nurse who's using a new revised national MCH register, tracking data, which for the first time includes data on child development status. Next slide, please. We see the communication modalities are changing, and providers are doing a lot more listening and observing as opposed to the one-way communication, which characterized care provision. And that's resulted in higher satisfaction for both patient and provider. Next slide, please. And here, and particularly in services like maternity and the children at risk, working with malnourished children and HIV-exposed kids, providers have more time to do demonstration and to actually help caregivers practice responsive caregiving and early learning during the consultation itself, so that they can take those new behaviors home with them. Next slide, please. And as we see interpersonal communication improving, we see improvements in quality overall. Next slide, please. I'm just going to skip over these quickly. These are slides from community health workers who have been trained in nurturing care and who are actively promoting play and communication in the home setting, and who have a sack of toys as they go do their home visits. We've seen in our evaluation higher productivity and improved outcomes from these efforts with community health programs. Next slide, please. And here we also see just a simple change in the culture of healthcare delivery, where community health workers, instead of just talking to caregivers, are interacting directly with children and modeling good behaviors. Next slide, please. So against this backdrop of progress, enter COVID-19, which of course has disrupted nurturing care work as it's disrupted everything around the world. We have fortunately seen lower numbers of cases and mortality in the countries where we work in Africa, and a relatively robust response from government as they gear up and try to better equip health facilities to ensure that they can provide services safely, educate their workforce. But we are seeing widespread fear on the part of the public of going to health facilities. Next slide, please. And a lot of the push from partners and government is to ensure that the health system is resilient and ready and doesn't suffer from some of what we saw during the Ebola outbreak, which was a disruption of routine essential maternal child health services. We're seeing really creative efforts to do training of frontline workers. Since we can't train face-to-face any longer, you have to using digital development platforms, digital platforms for remote training. Next slide, please. And we're trying to ensure that that young children are not forgotten during this outbreak. We're aware of all of the secondary effects, the stresses, the loss of livelihood, the stresses of confinement, and the implications that can have for children, and trying to keep those issues front and center on the agenda of the health sector and partners working with young children. So in conclusion, let me just, next slide, please. Just a couple of points about the opportunities ahead. I think we all need to recognize that system change takes time. We've done I think a remarkable amount as a community with very modest resources, but we need to be prepared for a decade or more of work to continue to build on these successes and to continue to transform the health system to weave child development into all nooks and crannies. I think we're all very encouraged by the response of governments, the readiness of governments. They understand the issue, it resonates, it's accessible, and it's compelling. And we're seeing donors, and we'll hear a little bit more from Aaron about that in a few minutes, like USAID, World Bank, the Global Financing Fund, DFID, all beginning to make investments in nurturing care and taking it on board. Just last point I'd like to make as we shift from this first chapter of nurturing care work to the future, I think there are important neglected populations and issues that we need to give greater attention to. Adolescent moms, children having children are a large group, 30 to 40% of all deliveries in many countries of Africa are to adolescents. So they have unique problems and unique challenges that we need to do more to address. Children with disabilities, we have a real opportunity through the nurturing care framework to give added attention through our developmental monitoring and ensure that they receive specialized services at the top of that nurturing care pyramid. And lastly, as WHO identified as one of its 4 core recommendations in their recently released WHO Nurturing Care Guidelines, that we need to do more to address maternal well-being. We know that 20% or so of mothers suffer from some kind of postpartum mental health challenge, and we have the tools to begin to address that in the future. So with that, let me say thank you, and happy to answer any questions that you may have during the Q&A session. Back to you, Laura. Thanks.
Thank you so much, Matthew. All right, I'm going to hand it over to Katie then.
Great. Thanks. Everyone can hear me? Good morning, good afternoon, good evening, wherever you are. Thank you for joining. It's a pleasure to be with this amazing panel. I wish that we were all in person, but still a nice opportunity to talk about these really critical and important issues. I'm going to shift gears a little bit. I think it builds nicely from Matthew's presentation the focus for all of us is to really strengthen existing systems and ensure that young children and families of young children are receiving the essential services so that all children thrive. But in many places where we work across the world, children are left out of those systems, often because they are displaced or refugees or for other reasons. And that is going to be the focus of my talk in how we're applying sort of the approach to integration of nurturing care framework in humanitarian settings. And with a specific focus on early learning and responsive caregiving, which spans typically the health and education sector, but where there's lots of powerful opportunities to integrate within existing health and nutrition services. So with that, I'll go to the next slide. So where are we now? For most of the world, we're feeling as if we're in a form of altered reality with disruption of services, economic impacts, high levels of uncertainty. And I think it's important for us to remember that for a huge proportion of the population globally, these types of service disruptions and uncertainty, unfortunately, have long been the norm. The latest analysis of the sheer magnitude of people who've been affected by forced displacement is above 70 million people, which is a 64% increase from just about 10 years ago. So we've seen very disturbing upticks in these numbers. And what does that mean for babies? In 2018 alone, 29 million babies were born into crisis and conflict settings. And over the past 5 to 6 years, that number has been about 12 to 20% of all babies born globally in conflict settings. Next slide, please. So the specific threats faced by young children in humanitarian settings, we know that they're experiencing these compounding adversities. You can say a triple or even quadruple marginalization, which we know is linked to poor outcomes across multiple domains of child development and can follow a child throughout their life and affect future generations. And what we're seeing is that young children are often just really falling through the cracks, where there's a lack of prioritization for early learning and responsive caregiving within the humanitarian system and within the places where these young children and families are finding themselves. And what this looks like is limited access to services, fragmented systems, and the basic lack of support that's needed for children to thrive. Next slide. So we know for all children, the period of early childhood is a critical time for brain development, when experiences and interactions with caregivers inform the formation of basic brain architecture, which is rapidly forming these synapses over the course of the first years of life. And this lays the foundation for all future learning. But we know from research, and this slide is from the Harvard Center for Child Development, but research from them and from others shows that the accumulation of persistent stress, and in particular when it's in the absence of safe, secure, and stable stimulating relationships with adult caregivers, that this can disrupt the synaptic connections and have long-lasting effects on children's future health, academic achievement, and well-being. And this is where responsive caregiving and early learning plays such a critical role, because it can serve as a buffer to protect the children from the negative effects of stress. So I would imagine that all of you from the education sector would agree, but we know that learning is not something that begins in preschool or begins in formal school, but really something that starts at birth, and that we need to be able to support caregivers and create environments that enable early learning and responsive caregiving from a very early start. Next slide. So when I referred to the triple marginalization, this slide represents where refugees and the forcibly displaced move to. And the orange is the countries where the majority of refugees end up resettled or are living. And these locations themselves are fragile locations. So the refugees and the families with young children who already are marginalized because of their forcibly displaced status are then landing in countries that also don't have the systems and the supports that are necessary to be able to provide them with the basic services. And layer on top of that the added vulnerabilities of age or pregnancy for pregnant moms. This really adds to the compounding adversities and the compounding stress that these families are experiencing. Next slide. We did an analysis just a few years ago looking at how nurturing care appears within humanitarian and refugee response plans. And plans are often different than what's happening, but even within the plans themselves, you can see that the vast majority include references to nutrition, safety and security, health, which are essential, critical components of the nurturing care framework, but much less of a focus on caregiving or early learning. Next slide. A further analysis that was recently conducted by Seek Development and commissioned by the Moving Minds Alliance showed that about 3% of development funding for crisis and conflict affected settings targeted young children or early childhood development. So 9 out of 10 of those dollars was for health and nutrition, and only 1% of that for education. And then if we look at humanitarian aid, just 2% of total humanitarian aid was targeting children 0 to 5 for early childhood development, with 28% going to health and nutrition and only 3% allocated for education. Next slide. So thinking about how we can develop interventions within the humanitarian sector, and this shares some commonalities with ECD interventions in more stable settings, but then takes into account some of the factors and the characteristics of refugee and humanitarian settings, where we have to implement, often design very quickly, and be able to understand the local conditions and try to introduce early learning and responsive caregiving interventions along building from the evidence base of what works in other settings. And often for my organization, but for other organizations working in ECD in this context as well, we think of our interventions as sort of those targeting caregivers and families, and those that are more focused directly on services for children. So for interventions supporting caregivers, we have often sort of a spectrum of different types of interventions, going from the more sort of intensive, which in refugee and humanitarian context might not be the most intensive that you could imagine, but for settings that are very resource constrained, anything that is sort of requiring more face-to-face time, more intensive training and professional provision of service delivery is classified as a more type of intensive approach. And that could include something like home visiting and mental health and psychosocial support initiatives that directly support caregivers, supporting them with their stress levels, giving them practical strategies, as well as providing them with support for their child's development. Play and communication strategies often tailored to the developmental abilities and the age and stage of the child. And I'll provide an example for that in the next slide. Then in kind of the middle, we have, just to go back, in the middle, we have sort of more modular group-based parenting sessions. And then on the universal side of the spectrum, approaches that really are more universal in their sort of spirit. And this includes the digital strategies, so mass media texting that could be linked to videos or tips or support that are provided to caregivers. Next slide, please. So one example of how we've been implementing integration of early childhood within health services for the Syrian response region is the Reach Up and Learn program. And this is a program that many of you may be familiar with. It was developed first in Jamaica, but it's been adapted in multiple different contexts around the world and has a large evidence base showing impacts across learning and behavior and economic impacts. So I'll show you a brief video of what this looks like when it's integrated within our community health volunteer system in Jordan. Thanks.
وين شعرات راشد؟ شعرات شطور.
شعراتك هاي انت شعراتك هاي حاضر. وين عين اللعبة؟ عينك وين عينك؟
تمام. هلا برنامج الطفولة المبكرة يعني هو برنامج يعطي نشاطات للأطفال الصغار من عمر 6 أشهر ل2 سنين ونص. يخلي الطفل يصير عنده تقوية مهارات إن كان بالكلام أو بالحركات. في فقرة الموسيقى، فكثير الطفل يحب الموسيقى ويعيش يعني يعيش حياة حلوة لما يسمع الموسيقى. حط الحلقة، يلا حط الحلقة، حطها هون، يلا حطها. شطور. نحاول احنا نضلنا نمدح على راشد لأنه المدح يخلي الطفل عنده تعزيز بالثقة.
كتير مفيدة وبتنمي مهاراتهم وبتفتح عقلهم. حتى ماريا أحياناً لما تمسك تكيف تقول لي ماما عملي لي نشاط.
فهي صارت تضبط معي النشاط، لما أجهزه وهي تجهزه معي، حافظيته كله، تحكي لي أحمر أصفر. فأنا لقيت الاستفادة أول شيء من عائلتي كعائلة، فكثير أنا استفدت بعلاقتي بيني وبين بنتي.
Thanks. Great. So that just provides a snapshot of what that home visiting approach looks like. And as I mentioned, integrated with our community health volunteers. So half of their visit is dedicated to health and nutrition counseling, and the second half to these early childhood development messages. Next slide. For programs targeting children, again, we have sort of a spectrum from intensive to universal, intensive being more preschool type programs, or where needed, referrals to specialized services for children who are demonstrating more severe effects of trauma. Play and learning spaces that may be like child-friendly spaces or centers where children can kind of drop off. Often parents drop off children if they're going to attend some vocational training or other type of service, as well as creating these spaces, as Matthew mentioned, sort of within health centers or spaces where families congregate. And then mass media. We have an exciting partnership with Sesame Workshop, where we've been supporting them as they've been designing mass media content, children's educational television shows that's really designed to reflect the realities of children and families who've been affected by crisis and conflict in the Middle East. Next slide, please. So in terms of COVID, one positive in this very difficult time is that we had been thinking of and working within sort of the digital and mass media space prior to the pandemic. And that did enable us to kind of continue to think through how we can leverage mass media. Sesame created apart from the clips that have been curated that are focused on health and hygiene and the great content that's developed on emotional vocabulary and strategies to deal with difficult emotions that have been shared with families via WhatsApp and other types of means. They also created a fun family special that some of you may have seen, or similar to some of the programs that were here in the US. So to really help give children ways to kind of talk about all of the feelings that they're experiencing and try to deal with this very strange situation. But a lot of the work that has been done in the Middle East has been through WhatsApp and digital. In other places of the world, we've been shifting to exploring more radio, or in the very bottom left, it's difficult to see, but this is an example of a user journey map that we've been working on for Bangladesh for the Rohingya response, where access to digital is not an option, or even a lot of sort of smartphone-based technologies or radios are not an option. And so it's looking at designing a call center type of approach with specific messages for pregnancy and for lactating mothers that integrate key health and nutrition messages, trying to promote behavior change, as well as focusing on responsive caregiving and early learning. Next slide, please. So key questions that remain to be answered, there are a lot, but some that come to mind are in terms of the variations across cultures and contexts, knowing that often, particularly in acute responses, there's an immediate need to identify what are the most appropriate strategies in that context. And often those are not contexts where there's existing programs or services that are focused on early learning or responsive caregiving. So how to create that in, for example, a context like the Rohingya across, and then understanding impact across various approaches to early childhood. So particularly when we're thinking of some of these lighter touch and now digital strategies, what are the impacts and the changes and outcomes that we can affect, and how are we monitoring and measuring that in a way to really be able to generate evidence and improve the performance of our programs and approaches. The other three are kind of key, I think, for any intervention, but particularly important for humanitarian settings: cost, scalability, and sustainability, where it may be more difficult to really articulate the case of why ECD, early learning and responsive caregiving, is so essential in the humanitarian response. We need to have crisp evidence on the cost, what are the approaches to scale, how we can embed it within national systems where possible, and how we can ensure that it's sustained. Just to reference again that Reach Up initiative, the analysis that we just completed in that report showed that the home visit, the addition of the ECD yielded about $8 per home visit cost, which, you know, while seemingly low in very resource-constrained settings, may be something that we need to further refine or reduce to make sure that it can be cost-effective. And then next slide, please. And a few opportunities on the horizon for further emphasis of ECD in humanitarian settings. The WHO, along with their partners, World Bank, UNICEF, and others, are working on the Nurturing Care Framework Handbook, and a piece of that will also include a specific kind of focus on humanitarian contexts. The recently released guidelines from WHO on counseling of women to improve breastfeeding practices and early childhood development also include mentions of humanitarian context. And there's complementary work to develop more practical guidance for how that can be used, or how those guidelines can be applied within humanitarian settings. And one of that is being led by the Emergency Nutrition Network, and the new infant feeding and emergency tools that are being developed, as well as the revisions of the MAMI tools. And then ongoing ECD and emergencies research that partners are conducting, as well as IRC, focused on our Auckland Simpson in the Middle East, as well as the new LEGO funded Play to Learn initiative. So I will pause there and recognizing I'm out of time, and hand it back to Laura, but look forward to questions.
Thanks. All right, Erin, last but not least.
Great, thank you. So I am going to be talking more about early childhood development and nutrition, specifically from the donor perspective. So moving to the next slide. So the Nurturing Care Framework and the ECD Lancet series, which have been previously mentioned, really provide donors like USAID with first the architecture for investing in early childhood development, and second with evidence to make connections specifically between early childhood development and nutrition concretely. As countries are starting to launch the Nurturing Care Framework, many bilateral donors now have an opportunity to support the operationalization of the framework across many sectors. USAID is collaborating within the health, nutrition, education, and social protection spaces to implement integrated nurturing care programs and contribute to the evidence base. So moving to the next slide. So what exactly is USAID doing? In the ECD space, we do have some key policies and priorities that are aligned with the nurturing care framework. First, USAID implements the US government strategic framework on advancing the protection and care of children in adversity. And this framework really focuses on building strong beginnings, putting family care first, and protecting children. We also have our multi-sectoral nutrition strategy, which highlights how nutrition-sensitive interventions can promote early childhood development. And then given the growing momentum related to nurturing care, especially within USAID, we now have an internal early childhood development learning exchange taking place across sectors to bring us together to collaborate more. Now going to the next slide. Thank you. So nutrition is critical for children to reach their developmental potential. Utilization of the nutrition workforce that, for instance, USAID has invested in for a long period of time to promote responsive care and early learning is really optimal, given the many entry points they have with caregivers, specifically at the community level. Adequate nutrition is one of the key components of nurturing care, which has been previously highlighted. And some specific examples of activities that are important for nutrition and developmental outcomes include responsive feeding, integrated nutrition and ECD curriculum and development and training, supportive supervision and mentorship, growth monitoring and promotion, and the integrated management of acute malnutrition. So going to the next slide, there are many donors like USAID now who are investing in global goods and processes for nurturing care, often in collaboration with WHO and UNICEF. One example is that USAID is now funding the development of early learning and responsive care counseling cards for nutrition counseling packages. These counseling cards aim to sort of add these two other components of nurturing care, early learning and responsive care, into existing nutrition counseling packages. This is being done with experts in the field and is really an example of how the global community is working together to create a resource for many low and middle income countries. This is also bringing elements of social and behavior change into the promotion of components of nurturing care. So also with WHO, USAID has drafted standards on nurturing care for smaller sick newborns. And we're also working on case studies to highlight how countries are implementing nurturing care in the context of smaller sick newborns, which are a critical population. In terms of data, USAID leads the Demographic and Health Surveys, or DHS program, which many of you are likely familiar with. And as of this year, there is a new vulnerable children module. And this is a global good that is publicly available, so can really add to the evidence base for countries. There is also an ECD module in many global national household surveys, including the DHS, but also the UNICEF mix. And these really allow countries to monitor and learn how children are developing in their countries. In parallel to these, there are other efforts underway, for instance, led by WHO, UNICEF, and the World Bank, along with other partners, to develop and sort of organize indicators so that countries can monitor how they are progressing with regards to different components of nurturing care as outlined in the framework. So moving to the next slide, So in addition to having core strategies within USAID that include nurturing care, the agency is being responsive to recent evidence with our programming to operationalize the nurturing care framework. New programs are being designed with bilateral country partners responding to the global momentum and evidence as USAID is integrating programs more. For instance, we now have integrated programs in Mozambique, Rwanda, and Cambodia with many under design or underway. Because nurturing care is a new area for USAID, new projects will have learning elements, and they will also have research to demonstrate to us as a donor what is feasible and to grow the evidence base more broadly. The nurturing care framework provides recommendations and doesn't focus as much on implementation. So research supported by donors like USAID can really inform the operationalization of the nurturing care framework. So some research that we are supporting is on modalities for integrated nutrition and ECD programs. For instance, in terms of not overburdening health staff and understanding how to effectively implement. So moving to the next slide, I would like to share a few examples of work that is taking place in a few countries that USAID is investing in. I will touch on some work happening in Ghana and then in Rwanda. So first in Ghana, the government developed early childhood care and development standards for children 0 to 3 years. There is also now a National Early Childhood Care and Development Coordinating Committee that works across different ministries. And then in 2019, the Ministry of Health updated the maternal and child health records books to enable the monitoring of developmental milestones. And this is similar to what Matthew mentioned previously took place in Zambia, where these record books now have pages for the monitoring of developmental milestones. And then our relatively new global flagship multi-sectoral nutrition project called USAID Advancing Nutrition is also undertaking some work in Ghana. The project is doing landscape analyses to inform integrated programs. These analyses will look at the types of available services and referral mechanisms, specifically getting at the quality of services, access to services, service provider competencies, including the use of and fidelity to national guidelines and tools such as these record books, and also looking at the policy environment more and service gaps as well as opportunities in terms of platforms to develop improved services. Then USAID Advancing Nutrition is also working with the National Development Planning Commission and local governments in Ghana to integrate multi-sectoral evidence-based strategies in districts' medium-term development plans. This involves working with many departments such as health, water and agriculture, social welfare, I already mentioned agriculture, and sanitation and education to promote nutrition and resilience while aiming to also improve developmental outcomes. So on the next slide, I will highlight an example of a Ghana ECD program focused on children 0 to 3. The USAID Maternal and Child Survival Program with Ghana Health Services developed and piloted a package of early childhood stimulation curricula and behavior change materials in 4 regions of the country. And these are really aimed to help health workers promote and integrate early childhood stimulation into routine health and nutrition services. And this was actually later expanded to social workers as well. An assessment of this package was undertaken with families that participated and found that children whose caregivers reported engaging in more psychosocial stimulation and responsive care practices displayed stronger overall development compared to those children of caregivers who reported fewer caregiving practices. So with this, I will move to the next slide focused on Rwanda, where there is also a lot of momentum around nurturing care. Rwanda has a fairly new national early childhood development program that emphasizes the coordinated delivery of nutrition, food security, health, education, WASH, and protection services through ECD centers and various ministries' systems. Further, USAID, UNICEF, and the World Bank, in partnership with the LEGO Foundation, amongst others, supported a national ECD parenting curriculum and home-based intervention that was delivered by community-based workers to promote early childhood development in some of the poorest districts within Rwanda. And this program aims to reach all families with children under 3. And then finally, I'll mention on this slide that the government of Rwanda is supporting the identification of developmental delays and referrals to health facilities. And the government is also supporting the building out of the workforce to provide rehabilitation services. This is really critical because in many countries, while there is screening for developmental delays and often referrals, there are limited services to actually provide support to children who have such delays. So moving to the next slide, I'll share a few specific examples of integrated programs in Rwanda. First is that NECDP and the Ministry of Health, along with other stakeholders, have recently revised the community maternal, infant, and young child nutrition counseling cards to now incorporate ECD principles and also add new ECD-focused cards. A second example of an integrated program in Rwanda is Gikuriro, which is an integrated nutrition, WASH, and ECD program. Gikuriro has nutrition interventions that are focused on nutrition education for improved practices. And now the program is reinforcing the promotion of activities that integrate nutrition and early childhood development through positive parenting education. One example of an activity that is taking place in this program is related to responsive feeding, which when done correctly can allow the caregiver to be attentive to children with hunger and responding to the child's feeding needs or cues, while improving communication between the child and caregiver, which ultimately helps to develop the child's verbal and nonverbal communication skills. A third integrated program in Rwanda that USAID has been supporting is Twiyubake, which is focused on orphans and vulnerable children and nutrition. This program is using ECD centers to address malnutrition in children. Caregivers receive nutrition education and messaging at ECD centers, and those caregivers with malnourished children are linked to nutrition interventions either provided directly by this program or through referrals to other nutrition programs such as Gikuriro. So with that, I will end on the next slide with a brief comment about USAID's focus in terms of COVID-19, since it is so prominent right now in all that we are doing. USAID is really supporting and emphasizing the importance of the continuation of health and nutrition services while aiming to ensure that the quality of services does not suffer. As has been previously mentioned, there is a lot of attention sort of redirected towards COVID-19, and it is important that the quality of health and nutrition services is really maintained to sort of protect and try to mitigate some of the predicted short and long-term effects of the pandemic on nutrition and ultimately developmental outcomes as well. So with that, going to the next and final slide, I thank you and look forward to the discussion.
Thank you so much. A lot of really rich information from our panelists. So we're going to open it up now. If you have questions, if you could please type them into the chat and I'll share them with our speakers. I'll start, since while people are teeing up their questions, I'll start with one question. I think, Matthew, you mentioned that there was still a need for better cross-sectoral coordination, and we did see in Rwanda, apparently, that the government is moving forward with that, but I think, particularly for those of us who work in fragile settings, Rwanda is usually an outlier in terms of achieving things in the development sphere. So I was curious if you could comment on what are some of the barriers to uptake of this kind of coordinated response across different sectors that you've seen, or what are some things that have facilitated better coordination across sectors by governments and mobilization?
Yeah, thanks, Laura. That's a great question, $1 million question. ECD as a field has really been challenged in this regard along at least the 25, 30 years that I've been working in this space, because of its very nature, being multi-sectoral really means that it does not have one sort of natural home and champion. Where we've seen the most progress being made in coordination, and where kind of countries have been able to or countries or even provinces or counties have been able to overcome some of what we often see as the competition for resources and leadership in this space that's been, I think, challenging and disruptive, is when we have executive leadership. And we've seen in Kenya, we've seen presidential leadership around the issue of ECD, when the president opened a regional ECD meeting and really brought ministers together from 4 different ministries and made clear that this was an executive priority. We've seen this in Zambia, and we're seeing it now in Ethiopia from really the highest levels of government, instructing ministries to work together and creating cross ministerial committees. We've also, sort of not let perfection be the enemy of the good. Really encouraged ministries of health to focus internally and look at coordination. And this is the area where we have really put our most time and energy between different departments that need to work together. We have multiple departments, as you saw from sort of the architecture of the health system, that need to be getting involved. We have a number of countries now that have created structures for cross-departmental coordination, that it's really spearheaded progress when you bring together the child health department, nutrition department, community health department, M&E departments, communications departments, planning, et cetera, often chaired or led by a senior ministry official. So, I think we're developing different pathways to improved coordination and better outcomes as we learn and grow as a community. Thanks.
Great, thanks. Okay, Erin, there's a question for you from Alejandro Lara. He asked, what is the status today of the relationship or funding to WHO by the current administration, and how soon will this funding cut affect current and future projects?
Thank you, Lara, and thank you for that question, Alejandro. So currently we are still collaborating with WHO per our previous investments, and we are still actually waiting on guidance for what will take place in terms of our relationship and funding with WHO. So that is still still sort of being sorted out in terms of what the implications are.
Great, thanks. All right, let's see. All right, I'm going to ask another question because I don't see anything in the chat. Going back to the question of adolescence, I was wondering if anyone wanted to comment on the opportunities to link with reproductive health programs and thinking about in contraception and family planning and integration with other programs.
I can say a few words about that, but I'd be curious to hear what other colleagues have. It's not an area where we have active examples, at least within my own organization, but it is an area that I think we're actively exploring and interested in, particularly as we've been thinking through integrated models starting in pregnancy or starting even before pregnancy, and knowing that that's often a trusted entry point where women are going to receive services. That's a place where they often have existing very strong relationships with the staff and counselors there, and so they may be more receptive to having a broader array of messaging and programming within those spaces. So we could look at opportunities for more focus on responsive caregiving and early learning there. But would love to hear from others what examples or ideas they have.
I'll jump in and just to say, I think, as I was saying at the end of my remarks, this is a critical frontier, I think, of programming, where we don't have a wealth of experience to draw on. But I think it's important that we look at the adolescent platforms that are focused on reproductive health and prevention of often pregnancy, to be inclusive also and recognize that a lot of young women are having babies, and we've pioneered an approach working with Dreams in Kenya, and that we're looking to introduce in Mozambique as well. The Dreams, which is HIV-focused adolescent programming, creates safe spaces where young women can go with peer support and receive a range of support services. And we've introduced play spaces, and which has increased in Kenya by 25% utilization of safe spaces as young mothers feel safe and not stigmatized coming in and participating in activities. So I think what we need is to again integrate into our frame of reference a focus on young moms, acknowledge that they need, within the context of those programs, unique support, and find ways of bringing that together. Thanks.
Yeah, and I will just add, in terms of nutrition, we are starting to think more about adolescent nutrition given their unique needs in terms of how to implement interventions and thinking about social and behavior change mechanisms that may look different for this population. And then I think in turn with that, think more about how some of these early learning and responsive caregiving messages can fit into that. But it is definitely sort of an unmet need, but a growing area in the nutrition space as well.
Great, okay, we have a couple questions now. So we have one, are you worried about stigma of children who are identified? I assume this is with delays, especially if there's not a lot of referral services available. Do you want to take that question? Oh, sorry.
Well, I mean, it's a really good question, and I think we need to be, and it speaks to how we do our training and how we do community awareness around child development, and we need to be sensitive to it. What we're finding is that while referral for specialized care is limited, those specialists do exist in all of these structures. They're weak structures that can be reinforced, and stigmatization, while it's an understandable fear, we're not seeing it as a problem. In practice, it hasn't been something that we've observed. So I'll just share that it's an understandable concern, but it's not something in practice that we're finding in our monitoring of programs across the region.
Yeah, and I'll just add, well, I think this is an area that's hugely important and one that requires a lot more investment and thinking. It is something that we've approached in kind of a light touch manner in places where we don't have very strong referral systems, is how do we think about supporting caregivers to adapt their behaviors and practices based on the child's needs. And this is really part of responsive caregiving, understanding that there may be some cases that are so extreme that do require highly specialized services, but a lot of what we're seeing, a child can continue to develop on their own trajectory and on their own course, albeit, potentially not the same as a typically developing child, but that with support to caregivers, they can still have very meaningful, positive relationships and help the child thrive. We have very simple booklets that we've developed, for example, for Reach Up and Learn. So if I'm having problems seeing, here are some things that you can do for me, or here are some things that you can, some ways that you can change your behaviors. And similarly for other types of disabilities, whether it's developmental delays or hearing or seeing or other things. So not solving the issue, but just one approach.
Great. All right, we have a question about how do we get more father involvement in nurturing care. The IRC video was very nice, showing a male community worker. Are there any other strategies that have worked to get fathers to engage in co-parenting?
Yeah, another nice question. What we have been doing with strong support from the government is really consistently, if you couldn't see in any of the materials that I shared, but you will see fathers, is normalizing involvement of fathers and showing fathers involved in play activities and communication activities and all of the job aids and tools that we're using. Gender is addressed in workforce training. So, I mean, I think it's in promoting and reinforcing a new social norm of male involvement through the various channels has been one of the real successes we hear. While we don't have data on it yet, unfortunately, we're hearing a lot of anecdotal information that fathers are really discovering their role as parents and enjoying it. I think it's an area where we need to do more documentation in the future.
Yeah, and I think this is an area where behavior change research is really interesting, to look at sort of what drives male behaviors, what motivates them, who do they look up to, who do they listen to, and trying to identify ways that we can create messages or model behaviors in a way that really speaks to them. And of course that varies by context, so requires a little bit of initial research and design and testing to try to identify that. But yeah, one thing I love about that video is that it shows such a wonderful, gentle, engaging male, not only health worker, but also father and UCD champion. And so it's nice to be able to showcase those examples.
And I will also add that we've also been thinking about, in a social and behavior change context, engaging men and fathers more, which isn't easy, but thinking about engaging them sort of as a separate population and what messages may resonate with them, but also thinking about, there are a few examples where community groups that have convened previously maybe were only women's groups, but now we're also incorporating some fathers so that there can be dialogue amongst everybody to incorporate varying perspectives and audiences to get fathers more involved that way as well, depending of course on the context and how culturally appropriate that may be.
If I could also just jump in and say, I think, there's a big push now to work more on the demand side and changing social norms. And for instance, in Zambia, UNICEF is spearheading a 1,000 Days campaign where this kind of modeling and male involvement can really be widely disseminated through national campaigns. We're using radio and video in Mozambique, and including a lot of male participation through those channels. I think they're particularly promising in changing those gender dynamics as we move forward.
Hi, this is Joni. I just wanted to add, I also think this is where the education space and the education sector can play a really meaningful role, because we often do have male teachers in the primary school in particular, and we have more in the upper grades, of course, but there are male role models in the education sector. And if we can work on behavior change of those teachers, of those school directors, of those regional people to really embrace the precepts of a nurturing care framework in education, we can really have the role modeling happening with parent-teacher associations and school-based things that might attract men more easily. So I do think there's a big role for education to play in really changing the behavior of who caregives.
Great, thank you all so much. Looking at the time, I'm going to wrap up and hand it back over to Joni, who'll give a few closing remarks, and then Paul will have a couple announcements, I think, at the end. So, Joni?
Great, thank you. Thank you, Laura. And thank you, Erin, Katie, Matthew, and all of SID for helping us to put on a fantastic panel about a really important issue that seems even more vital and important right now as we pivot and think about how do we support families, communities, children, and vulnerable children in this time of social isolation and COVID-19. I want to thank everyone who listened, and I hope this will urge you, if you're not familiar with the Nurturing Care Framework, to Google it, to look at the toolkit, to look at the guiding principles and the work being done, and of course, to read the articles that kick this all off, the seminal work in the Lancet series from 2016, so that we can continue the conversation. And I just want to end on the note, I want to put in a special plug to my education colleagues to really think about what are the pieces of this framework we can think about together and holistically integrate into the education space, as they seem to be able to do a little more readily in the health space, so that we can together really look at how we support communities, families, children, and all stakeholders who care about children. So thank you very much, and I will turn it over to Paul.
Great, thank you, Joni, and everyone else, Laura, Erin, Matthew, and Katie. We really do appreciate your time, and everyone for attending today. We dropped a link for the just a brief survey for our events. We really would appreciate your feedback if you have any. So my intern Alice just put the link in again. So it's in there twice. So please do fill that out. We would really appreciate any comments you have on our events. And with that, we thank you for joining us today. We hope to see you at one of the other events we have this week. We hope you stay safe and healthy during these crazy times. Thank you.
Thank you.
Thanks, everyone.
Thank you. Bye.